Hello and welcome to my video on Thiazide Diuretics. I will give a broad overview of this class of medication to serve as a review or an introduction to anyone wanting to learn more about them. This information will help you if you are trying to learn more about these medicines for your patients or if you yourself are taking them. When I say thiazide diuretic, it might not mean much to you right now, but you will feel pretty comfortable with them by the end of this video. With them being diuretics, they are involved with getting rid of fluid in the body. These are different from the loop diuretics that I have talked about previously, in that they are focused mainly on reducing blood pressure, not so much getting rid of the excess fluid. There are a couple different kinds of these diuretics, but all are taken by mouth, mostly tablets, except one that can be used IV. There has been debate on which one is better between hydrochlorothiazide and chlorthalidone. Chlorthalidone was the one most of the studies were done on, but hydrochlorothiazide is the more widely used of the two. Hence the everlasting argument between one trying to outshine the other. As I mentioned just before, the thiazide diuretics are used primarily for blood pressure. In fact, they are what we call one of the first-line medicines for blood pressure, which means they are one of the top 3 drug classes that a newly diagnosed hypertensive, or a patient with high blood pressure, is started on. They do lower the blood pressure pretty good, and all in all have a pretty low incidence of side effects. So a win-win there. By the way, ACE inhibitors and ARBs are one of the other top 3 drug classes for blood pressure as well. Even though their primary focus is blood pressure, they can still help with getting rid of excess fluid in the body because they are diuretics. Just not as good as loop diuretics, which is why they are typically not used alone for getting rid of edema or unwanted fluid buildup, but rather used in combination with other medications. And they are used that way especially in acute heart failure issues. They are added on to a loop diuretic to not only help with more fluid removal, but to potentiate the loop diuretic's effects as well. While how the thiazide diuretics do what they do can be rather complex, it is also easy to summarize it. They work in a specific part of the kidney to stop sodium from being reabsorbed back into the body. That is pretty much it. Now from this increase in sodium being expelled from the body, chloride goes with it, and the two make salt. And then water joins in on the fun and you have a bunch of water leaving the body now in a diuresis. But sadly, salt and water isn't the only thing taking an express ticket out of the body. Some electrolytes join in too, specifically potassium. And this is where most of the side effects from thiazide diuretics come from. Electrolyte imbalances due to the fluid going where it wasn't initially intended to go. So with the decrease in potassium, lab values need to be monitored, at least initially, and in some cases heart rhythm should be checked if there is a concern for the specific person, since potassium can affect how and when the heart beats. Most of this can be avoided if you just increase the amount of potassium in the diet by a tad, bananas, potato skins, what have you. An interesting thing with the electrolyte imbalances is that it can raise calcium levels. Now in some cases, yes, that can be bad. But this has actually been shown to be more on the beneficial side with thiazide use. First of all, it can help decrease the incidence of certain kidney stones that are calcium-based because it gets the calcium out of the kidneys and back into the bloodstream. Likewise, with the higher calcium in the blood, it can help with osteoporosis, especially if they have lower calcium levels. Long-term use has even been shown to reduce the chance of hip fractures in some people. So all in all, this electrolyte imbalance has a net positive effect. They can also decrease magnesium levels and increase the incidence of a different type of kidney stone. The thiazides can even make gout worse or cause some people to get gout. They have also been shown to increase blood sugar by a modest amount as well. Total cholesterol can also be increased with the thiazide diuretics, but this is usually if they are started off with high doses from the get-go. An interesting fact about them that makes sense if you think about it is that their function, or effect, decreases with decreasing kidney function. They do work through the kidneys after all. But once the kidney functions drop to a certain extent, their effect is all but lost, except for metolazone. It can still do its deed with reduced kidney function. That is but one of the reasons why metolazone is typically chosen for heart failure patients as the add-on to loop diuretics. Piggybacking on that idea is another reason you do not want to take NSAIDs such as ibuprofen and naproxen while on these if you can help it. NSAIDs are not good for the kidneys and contribute to water retention. They even raise the blood pressure as well, so kinda working against the thiazides in almost every way. Some quick facts to wrap this up, starting with an obvious one. Take these in the morning. Again, they are diuretics. They will make you go bathroom ever so frequently, and you simply do not want to be doing that all night long. Another one is about dosing. Now I usually don't like to get too much into dosing, but these tend to get overdosed in certain circles. So for hydrochlorothiazide and chlorthalidone, the accepted max dose is 100 milligrams for both. However, the clinical, or really practical dosing, tops off at 50 milligrams for hydrochlorothiazide and 25 milligrams for chlorthalidone. Anything higher than that for either one will just increase the chance for side effects without giving any real boost to the actual effect you are looking for. With that, this concludes my overview of the thiazide diuretics. I hope that this has benefited you in one way or another. As I have mentioned, this class of medication is great for lowering blood pressure, in fact, one of the best, so it is good to be aware of these diuretics. I release videos fairly regularly on medications and pharmaceuticals, so if you like quick, concise overviews, I hope you subscribe so you can keep benefiting from my videos. Have a good day.